Hey y'all. Hey Lisa.
Hey, Stacia.
Hey.
How's it going?
Good. How are you?
Good,
I
good,
love
good.
this shirt.
You
Yes.
know, had to give a little spring
Yes.
fever on
Look,
you.
I'm
You know
looking
what
real uh in the house-ish. And you
I'm
looking
saying?
real stuff out-ish.
No, listen. If we can't, have the spring that we want to, we got to bring spring indoors. You feel what I'm saying?
That is true. That is
Well,
true. Yeah.
exactly.
Yes.
I know. I haven't even really been outside for real today, but it
Me
looks like it's nice
neither.
out.
It was raining. Like it started raining out of nowhere. So then in the house. Sad face.
Yeah, I know.
Yeah.
Pretty crazy. But that rainstorm last night was off the chain. I heard it through my window.
I don't even remember hearing none of that.
Oh
I
yeah,
was in real sleep.
yeah. It was off the chain.
That's wild.
Yeah.
Yes.
Yes. Very rainy,
Definitely
Roger.
right.
We're just gonna wait for a few more people to log on.
Yeah, we can give it a couple more seconds.
Awesome. I need to find something else on Uber Eats Station. I have been listen.
No,
I know the delivery people
I'm
try hard.
done with delivering this food delivery situation. Grubhub took 2 hours to bring my food to me yesterday.
2 hours.
Yes, I had to
Oh
contact
no,
customer service and everything. It was a real bad situation,
that's
but
off the chain.
when I got it, it was good. So that kind of smoothed it over. But
Wasn't it cold? 2 hours
no, it
later.
was the thing was I think the driver was the issue. The food wasn't the issue.
Okay,
The food was hot when I got it. Well, it was warm. I ain't gonna say it was hot, but
got you.
it was stuff that could be warmed up, so it wasn't so bad.
Listen, y'all people in the comments can stop judging me for not cooking. That's what I know.
I've
Cause I
been
don't know how to use a
cooking,
spatula.
y'all. I've been cooking. I'm just tired of cooking. I really am. Sometimes you need a break.
Yeah, my break's been 31 years though, so that's been
Yes,
problematic.
but I need you to do better.
I listen. I can throw down a ham sandwich. Don't do me. Don't do me.
Look, the sandwiches can hold you over, but
That's right.
you gonna have to start following some recipes or something.
Mm-mm. I've tried Blue Apron. I have tried HelloFresh, which gives you the step by steps, and I still don't know what they're talking about. Like saute. What is saute? I don't know what that means. I'm completely confused what's happening right now.
I have faith in you. You're gonna get it. You're gonna get it. When you ready to start, we got 11 people on right
Uh-huh.
now.
All right. I got 11 people. I can dig with that.
Okay.
Cool.
So first, I'm gonna introduce myself. My name is Seisha Moody. I am a community outreach specialist in the community health department at Whitman-Walker. HA, you want to introduce yourself?
Cool. My name is AJ King. I'm the mobile health supervisor at Whitman-Walker Health, and my preferred pronouns are he, him, his.
Yes, and my pronouns are she, her, hers.
Awesome.
So during the past few months, Whitman-Walker's Health Community Health Department has expanded its outreach efforts to social media. So we are covering various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So that's what we're trying to do today. So, AJ, you want to talk a little bit about what we're going to be talking about today?
Sure. So before we get there, I kind of just want to check in with you. Like, what have you been doing to, maintain yourself through this crisis? I know that we're in very, very stressful times right now.
Yes.
And, finding effective ways to manage your time, to de-stress yourself, take care of your mental health. What have you been doing on a daily basis?
So, outside of teleworking, thankfully, but still working, I've been watching a lot of Hulu, a lot of Netflix, catching up on my shows because that's kind of like an escape for me. Also, going outside, walking, trying to get in a little exercise. I'm not a big exerciser, so I'm trying to do a little better. And really just make sure I stay in touch with my family, catch up on some cleaning, and really, that's really it.
Cool. I can dig it. Yeah, no, pretty much the same here. I'm still teleworking. Grad school had switched over to online. So, I've been keeping busy with studying and getting all that work done. We're about to be in finals. Outside of that, like you said, a lot of Netflix, a lot of Hulu, that Little Fires Everywhere with my girl Kerry Washington. It's a
Yes.
move. It's a move.
Wow.
Cleaning up, not cooking. Trying to go outside, I have like a dog park in my backyard, so going out there,
Okay.
get fresh air. But really just focusing on myself. Like this is giving me a rare opportunity to just sit down for a minute and marinate in AJ and find out what marinating in AJ looks like. Which has been scary, but also really dope at the same time.
Yeah.
Learning myself.
Good.
Absolutely. And a lot of Housewives. That's right. Davon Hamilton. So Housewives of New York is always getting me. Yep.
Ryder said he's been taking care of his plants, focusing on finishing the semester, meditation, and prayer. I hear that. Yes.
That's awesome. That's awesome. Cool. So why are we here today? So Station, I just spoke a bit about how we are maintaining, going day by day amongst this COVID-19 pandemic. And different people are coping in different ways, right? Some, through meditation, some through exercise, some through cooking. But then there's other people who seek it through sex, through alcohol, and through crystal meth. So what is crystal meth? Some of us, we may have heard it, in high school, middle school, health class, but don't really know too much about it.
Right.
And crystal meth may actually surprise a lot of people to know that it is very high in rates, particularly in metropolitan cities, in urban communities, particularly in gay, bisexual, male communities, and trans women communities of color. There's a lot of belief that it is a more rural drug, that is more of a white drug, and all these things. That's absolutely not the case anymore. So crystal meth is also known as Tina or ice or tea. It's a very extremely addictive stimulant. It causes a significant release of dopamine and can last up to 12 hours or more. So it's not like marijuana where you just, smoke it once and, get a little high and you're good to go in an hour or two. This can last days, depending on how much you intake. It can last a very, very long time. It can be ingested, snorted, smoked, injected, or even inserted through the rectum.
Wow.
And like I said, it's become an endemic amongst urban gay and bisexual men and trans women of color. It's almost become this cultural norm in this underground community, in something that's called the party community. Have you heard of the party community, Sasha?
I have not. Can you please explain what that is?
So the party scene is something that has become pretty popular in our community. More people are in it than you would think, right? So basically, it is a scene where men get together and they engage in crystal meth use. And they also call it party and play, or PNP. And they engage in crystal meth use together, and many times have group sex, right? And within this group sex, they are not necessarily, drinking fluids or staying hydrated or eating or sleeping. They're not sleeping for days, right? Which can obviously, take a hit on your immune system, is not the healthiest thing to do for your body. Just to, for regular day by day, and this can go on 4 days where this is happening. So it's known as the party scene. If you are on any of these gay hookup apps like Grindr or Jacked, if you see a diamond or you see the capital letter T, that typically means that people are looking to party, to engage in group sex with multiple partners or maybe just one partner, but while using crystal meth.
Wow, thank you for explaining that. Somebody asked, What do you all think has caused a big increase in uptake in chemsex, particularly tea and other drugs that are highly addictive among our communities of color?
It's a great question. I've heard a lot of different theories around it. A lot of clients that I've worked with, and even close personal friends in my life who are engaged in the party scene.
Mm-hmm.
Um, a lot of them have a very similar story. Now, this isn't across the board, but
Right.
a lot of them have had a ed buck situation, right, where it's
Mm-hmm.
typically elder men in the community who introduce them to the drug. May provide them some money, maybe some marijuana, building up that those trust and that those relationships, and then they introduce them to the drug, right? But they may be able to be functioning with that. The young people they're introducing to it may not be able to function, right?
Right.
So then become addicted to it, and then now that's when we run into some issues. Um, why people try it. I mean, there's a multitude of reasons. It could be for resources, for housing, money. It could be just out of curiosity. It could be,
Mm-hmm.
they may not know what it is. I've actually had some clients who have came in and said, hey AJ, I've tried this new drug called Tina, and I was like, well, it's crystal meth, right? And they
Right.
say, no, it's not. I wouldn't use meth. That's the for people in the country. Ooh, that's no, it's just another name for crystal meth, right? So there's a multitude of different reasons. Yeah.
Great answer. Um, so, who would you say is mostly at risk for participating in crystal meth use?
I mean, it really can be anyone, right? But
Right.
I think that we are seeing an uptick in metropolitan cities and urban communities, particularly amongst gay and bisexual men, particularly of color. Um, and it's something that is really unspoken. People are not really talking about it.
Mm-hmm.
People aren't really addressing it. It's one of those unspoken things. It's not like this one image that you may have of someone who uses meth. It is CEOs of companies, it's lawyers, it is advocates, it's
Mm-hmm.
it is the homeless youth, it is the pillar in the community, it is the club promoter or whoever. It's any and everyone, right? And it's because it's such a discreet um, community, you would never know who's using. Um, but the problem within that
Mm-hmm.
is that crystal meth can do some damage to your body, mentally and physically, right? So when people engage in crystal meth use, one of the reasons why so many people are so attracted to it is because it makes your inhibitions pretty much just disappear, right? Your sexual arousal is through the roof. Let's say that you're someone who identifies as a strict top,
Mm-hmm.
and there's no way that you would ever bottom. That might give you the confidence, and you may be eager to try bottoming or try some other sexual activity that you never tried before. Maybe something that's very kinky or taboo that you wanted to try. It gives you the confidence to be able to do that. Your judgment is skewed. You're in this community of people who aren't just many times just random people, but people you've built a family and trust and community amongst.
Mm-hmm.
And so breaking away from that, particularly when it could be potentially a chosen family that you
Mm-hmm.
have developed, would be difficult for some people to do. Um, so with that being said, though, it does some damage to your body, right? So if we're talking about it from a mental health perspective, crystal meth floods the brain with dopamine. It just does. It's a feel good chemical, and the effect of the flooding can cause uh, or exacerbate short-term and long-term mental health consequences, such as anxiety, severe panic attacks that can persist even after you stop using it, depression, persistent mood swings, paranoia, hallucinations
Mm-hmm.
that can actually become permanent, psychosis, and some people even have like this feeling of like bugs crawling all over their skin.
Wow.
So, and that's more so on the mental health aspect, right? What it can do for your body, like, I'm sure some people have seen a lot of photos of people losing their teeth, or like their skins become, almost very gray, like, and you're seeing that the people's faces change and they get extremely skinny, and it definitely, is not good for your immune system and just your overall health. And the interesting part is some reasons why I've heard people use crystal meth in our community is some have said, oh, I'm just using it to lose weight, or I'm just using it because pride's coming up and I just want to get my body snatched for that, but I'll stop using it after that. Or, oh, I just use it just because the sex is really good on it.
Wow.
um but not, but the missing piece around that is, okay, but what are you exchanging for that? What are the consequences coming from after that? Do you see what I'm saying?
Right. So somebody said, how can we get involved in supporting our cause or supporting your cause?
It's a great question. So I think that getting people, well, so the point of these talks that we're having on Instagram Live is to educate and to provide information around these different topics, right? And it's each one teach one. So you're taking this information, you are teaching and telling your friends, your networks, your colleagues. That is helping them because you don't know if maybe they're using crystal meth, right? And you're providing them this information. It could be prevention mechanisms. It can be people who may be using, and it's kind of the light bulb goes off. Oh, I didn't know that happens.
Right.
And it's utilizing the resources. It's promoting the mission and what our goal is overall, right? And I want to make something very clear. We're not here to say everyone needs to stop using meth. That's not what we're here to say.
Definitely not. That's not.
We're here to say if you are going to use, let's talk about some risk reduction measures. Let's talk about some ways to do it in the healthiest way possible.
Mm-hmm. So what are some of those ways?
Great question. So before we get there, I want to scale back a little bit, and because it's gonna connect to overall of ways that you can do it in a healthy way, right? Mm-hmm. So using crystal meth can actually increase your chances of contracting HIV and STIs, right? Like I said, you are engaging in potentially high-risk sexual activity if you're having multiple partners at the same time. Like I said, your judgment may be skewed. So if you typically use condoms when you're not using, but you may not use them now, you may have forgotten to take your PrEP if you're on PrEP. If you are already living with HIV, then you may forget to take your medication for treatment, which means that you're less likely, if you're not adhering to your treatment, to not be undetectable, which means it's easier to transmit to others. Also, crystal meth actually causes mucosal dryness, excuse me, y'all, which increases the risk of tissue tearage, leading to higher risk of HIV and STIs, right? It can cause erectile dysfunction, which can lead to more aggressive sex as well too. Mm-hmm. People are sharing needles many times, so if you're injecting it and then you're just passing that needle over to someone, and this person over here has HIV and the other person doesn't, there's transmission happening right there. There's so many different ways that it can happen, right? So we're here to talk about what risk reduction looks like, right? If you're in those types of scenarios. So to answer your question, I know you were saying, like, how do we protect ourselves? So there's a few different ways that we can do that. If you could maybe make like a party kit. So a party kit could be something where you have a bag when you're going to these parties, where you have lube. And the lube is super important because, like I said, it could dry up your mucous membranes, which means that tearage can happen a lot easier. Transmission of HIV and STIs much easier, right?
Right.
Condoms, bring a lot of water to hydrate yourself, and sterilized syringes. So sterilized syringes, right? If you guys are not familiar with HIPS, HIPS is a great organization here in Washington, D.C., and you can contact them. They actually have a clean needle syringe exchange program, and they will come to your house, no questions asked, drop off clean syringes, and hit it. So if you're partying, you can do your thing, right? You can with clean needles, right? And that's the prevention piece when it comes to HIV.
Okay.
STIs. We live in a bit of a different time now, right?
Right.
We can switch gears a little bit. Yeah. I was talking, from a perspective of maybe 2-3 months ago. What's going on right now, right?
COVID-19 nonsense.
Baby, COVID-19. Yeah, COVID-19 came with a fierceness, and it definitely changed the trajectory of how we do a lot of public health work, of what risk reduction looks like. And, it just means that we have to do things a little bit differently now, right? So, first and foremost, we need to follow the CDC guidelines of physical distancing, staying home, washing our hands, sanitizing our hands, doing all that. Let me be clear on the difference between physical and social distancing. So physical distancing is staying 6 feet or more apart from an individual, right? Social distancing would be you're losing all communication, right? So you're not talking to anyone, you're just disconnected from the world, you're doing all that. We don't want you to socially distance.
No, do not socially distance yourself. Physical distancing, yes. Social
Correct.
distancing, no.
Absolutely. Absolutely. You want to physically distance yourself.
Mm-hmm.
Still be on FaceTime. Go on house party. Talk to your friends on the phone. Do those things to maintain those relationships and those communications. Physical distancing is what we're talking about. And that's going to be super important, right? Because as we've heard, I know it's been put into our brains 5 bajillion times through the news, through social media. But when we're talking about transmission of COVID-19, we know that the virus is spread from person to person through droplets from coughing, sneezing, and formites, which is when the virus is like on a surface and someone touches it and then touches their mouth, their nose, or their eyes, right? So, which is why a lot of people are now wearing masks to protect themselves, right, and others. And the crazy part about it is there are many, many, many people who have COVID-19 and no symptoms. They're asymptomatic. Right. So they're going about their day, watching Netflix, chilling, kikiing, having a good old time. And the whole time they have coronavirus and don't know it. The problem is that they're asymptomatic, but that doesn't mean that the person that they give it to is going to be asymptomatic, right? So bringing it back to what we were talking about previously, COVID-19 has been found to spread through saliva, right? And fecal matter. Mm-hmm. So if we're talking about engaging in sexual activity, that means kissing. That means if you're rimming, right? That's transmission. That's transmission of the virus. And you can't really engage in sex like you used to without.
Yes, Norma, that's correct.
Right?
25%, according to the CDC, are asymptomatic. They don't have any symptoms and they have COVID-19.
That's the same. 1 in 4. Mm-hmm. 1 in 4. So you just don't know, right? So it's challenging. It's challenging. I know a lot of us miss sex. I know a lot of us, miss that touch and that feeling. But we just need to kind of change what it looks like for right now, right? Until we figure out some things. So going back to the recommendations, again, this is what the CDC guidelines say about physical distancing, staying home, sanitizing, washing your hands. If you are going to use crystal meth, make sure you do not share your pipe or needles, right? So let's say that if I'm using it, crystal meth right now, and then my partner's right here using it, use separate pipes, right? Because that saliva from my pipe now they may transmit it from that, right? Mm-hmm. Or same thing with needles, obviously, right? Make sure you're hydrating. If you're going to use it by yourself or use it with a living partner who you use with, right? Don't try to avoid the party scene as much as possible for now. I know it's going to be a little difficult, but try your best to avoid the party scene. The more people that are involved, the more at risk you are, particularly because what we talked about earlier, it skews your judgment. And you may go into the party thinking, oh, you know what? Of course, I'm going to, use condoms and I'm not going to kiss. I'm just going to go in there, perform anal, smoke, perform anal, call day and dip, and I'll be good from COVID-19. But then you get there and you take a couple hits and that guy over there looking real cute and he ain't coughing, so I'm sure he's fine. Let me go ahead. He real cute. Let me just give him a chance, right? Next thing you know, you're at risk now, right? So try to minimize your partners or at least do it by yourself, right? And we also tried, if you're on PrEP currently, try your best to stay adherent to your PrEP. If you're in treatment for HIV, stay in treatment as much as possible, right? Continue your safer sex practices. We recommend for now, obviously we want that physical distancing, to use and clean your sex toys. Just use your sex toys for now, explore your bodies, learn new fetishes you like, learn new kinks you like on your own body, but make sure you're cleaning before and after the sex toys. And
going back to PrEP and PIP. So, even though we're in the house and you feel like you may feel like, oh, I'm not doing anything. What if tomorrow all of a sudden we can go outside again?
Ding, ding, ding.
Then what?
Absolutely.
So please stay adherent to your PrEP PEP medication, your PrEP medication, ART, all of that, please stay adherent to it.
Absolutely. And, kind of like what I was saying earlier, crystal meth damages your immune system. And
Mm-hmm.
one thing that we're seeing all over the news is the people most at risk of being in danger from coronavirus and having serious illness are people with compromised immune systems, right? So let's say that you are someone who's already living with HIV, you're using crystal meth, and you're not adherent to your treatment for HIV, so your viral load is very high, right? Um, your immune system, like crystal meth, is just damaging you even more.
Yes.
And so now in comes COVID-19, right? We have a big problem here. We have a huge problem here. So, it's definitely put another wrench in this, right? COVID-19 put a wrench in how people use crystal meth and engage in sex. But it's super important that we're having these conversations and learning different ways to navigate what this is going to look like.
Mm-hmm. We have a question. Where can I get PrEP and PEP question mark?
Great question. You want to take that one?
Sure. So we offer PrEP at Whitman-Walker. And for those who don't know, PrEP is pre-exposure prophylaxis, which is medication that you can take regularly that can prevent you from contracting HIV if you was ever exposed to it. And PEP is the post-exposure method. So say you had an encounter with someone, you feel like you may have been exposed to HIV, you can take PEP. The PEP regimen is about 28 days, and that can prevent you from contracting HIV from that exposure. If you feel like that's something that you may be interested in, feel free to call our resource line, and we can get you connected to start PrEP. If you're right now at Whitman-Walker, we're currently only seeing patients, so it's possible that we could direct you to where you could be seen to get PrEP. And are we seeing patients that? I just moved here. Are we taking new patients for PEP agents?
For PEP, yeah. So
Okay.
if you are in need of PEP, then we can still provide those resources if needed. But you need to call to make so we can do an evaluation with you on the
Right.
phone to see what we got to do. Do we have any questions from people?
Let's see. That was the last question that we had.
Cool.
Scrolling up to see. Somebody asked what house party was.
Okay, so House Party is this really dope app, right? So it's kind of like Zoom or FaceTime, but you can have it with multiple different friends, and you can play games. So you can play Cards of Humanity, you can play trivia, you can play Heads Up. Um, it's a really cool app. So I know that I've been having some game nights with some friends. So definitely check that out. Check that out. It's something that'll definitely pass time. Have a nice little happy hour. Friday night. Say, okay, we're gonna have house party at 8 p.m. Y'all log on, have some wine, and play some games.
Yes. I'm going to pin the resource line at the bottom. Give me just a second.
Awesome. So I just want to repeat again that the reality that we're living in is that before COVID-19, many people, particularly men who have sex with men, were using crystal meth, right? And are using crystal meth. And when I'm bored at the house now and I can't go anywhere, right? Their go-to mechanism is meth, right? So we want to make sure that you have all the resources and all the knowledge that you're doing it in the most safe and effective way, from not only preventing HIV and STIs, but also protecting yourself from potentially being exposed to COVID-19. We live in very strange times right now, y'all.
Yes.
We live in very strange times right now, and we have to take extra precautions. You got to wash your hands as much as possible, sanitize as much as possible. You have to physically distance from at least 6 feet. This too shall pass. Things are going to look a little bit different on the other end, but this too shall pass. But we have to make sure that we are taking the measures right now to ensure that we are keeping ourselves safe and our loved ones safe if we want to beat this, right?
Yes.
So, I'll quickly just kind of go over the recommendations one more time. Follow the CDC guidelines, physical distancing, staying at home unless you have to go out for resources or for work or whatever. Wash and sanitize your hands. Cool, that's baseline.
20 seconds. 20 seconds.
That's right.
Sing your ABCs.
Happy birthday.
Whatever you gotta do.
Yep. Or, a Beyonce song. That's my favorite.
Yes, or Beyonce. Beyonce.
That's right. If you're going to use crystal meth, do not share your pipe. Use your own pipe. Do not share your needles, right? Again, HIPS has a needle exchange. They will bring you free, clean needles, no questions asked. Again, the number is 1-800-676-4477. Okay? 1-800-676-4477. They will bring the needles to you, no questions asked, all right? Try to avoid the party scene, P&P, party and play. If you're going to use it, either use it alone or use it with whoever your partner is that you're staying with if they use. Hydrate yourself. Drink as much water as possible. Stay hydrated. Sleep. Oh, that's another thing. Sleep. Make sure you're getting as much sleep as possible. Many times when you're using meth, you are up for days. Right? If you're living with HIV, make sure you're adhering to your treatment. If you're not linked to treatment yet, you can still get linked into care. Get on or stay adherent to your PrEP if you're on PrEP. Make yourself a party kit. If you are going to party, make yourself a party kit to make sure that you're taking as much risk reduction as possible. That's going to include lots of lube, right? And use the good stuff, water-based silicone lube, all right? Condoms. Bring some bottles of water with you, and your sterilized syringes if you're someone who points. Continue your safer sex practices before COVID-19. Make sure that if you are using sex toys, you clean them before and after. Clean before and after. That's going to be super important. Masturbate. Learn your body. Learn what you like. Things you never explored before, try it out, right? These are some tips to really help you out. But like I said, we will get through this. Just make sure that you stay strong. Reach out for support and, try some new coping mechanisms for this hard time. I know it's a difficult time we're living in. Like, if you've never tried meditation, there's lots of free meditation resources online right now. If you've never, hopefully we have the summer, right? So, we can get these summer bodies together. There's so many free exercise things, on the internet, on TV, that you can do at home, right? You said what?
I said a lot of lives, Facebook lives, Instagram lives, people working out. So you join in. Also, somebody mentioned in a previous live that we had, you can check back on Whitman-Walker's page for those. They said using TikTok. Never would have thought about that, but yeah, use TikTok to exercise. Learn all the new little TikToks. Somebody said, is soap and water okay to clean toys? Yes.
Absolutely. Yeah, use some soap and water on those toys and you'll be good to go.
Yes.
All right. I want everyone to just also try your best. I know it's difficult, but try your best to find a silver lining within all this crazy right now. That for me, that silver lining is my life is so chaotic because it's so busy. I've been forced to sit down and learn who AJ is, right? And it's uncomfortable, but it was necessary. It allowed me to restabilize myself, right?
Yes, you better come on, AJ.
Listen, it's a word, but it's really important for you to kind of find the little gem within all of this, right? Because you have to find what that gem is for you. It could be something as simple as that you can now reconnect with your family member that you haven't talked to in a long time, right? Your family member who lives in Mexico, right? Talk to them. You have nothing but time in your hands at this point, right? Reevaluate what your career goals are. Go back to school. Sign up for online classes. You've always wanted to go get your bachelor's degree. Go online, right? There's plenty of online classes. And even if it's not an online class like Everest, for example, most schools like GW and UDC are online courses now, right? This is your time to build yourself up.
Right.
Yeah.
Definitely agree with that. Definitely. And another silver line for me, what I've been thinking, like, I know on a regular basis, a lot of people are not outside, but now, like, even just walking around on the neighborhood just taking a walk. I'm seeing people in their yards and things, and that's just like younger people because oftentimes you see elderly outside doing
Yeah.
certain things, but like a lot of younger people. So that's great to see. So get out and get some fresh air. Maintain your distance, but still get out, get some fresh air, walk around, do a little outside exercise. You know.
Yeah.
Anybody else have any questions about anything? No. Okay, well, AJ, anything else you got to say or want to say?
Look out for one another. Look out for one another. Look out for your extroverted friends. The extroverted folk are
Yes.
hurting right now,
Oh, yes, that's very important. Yeah.
Listen, I'm someone who every Sunday you would find at brunch, followed by, the Brixton and cocktail in my hand and, happy hours and all that. And now I am, there's only, like, I finished Netflix. You know what I'm saying? Like, there's nothing left. You know what I'm saying?
Right.
It's a transition for everyone.
Mm-hmm.
Take care of yourself and others. Take care of
Right.
yourself and others, particularly those people in your lives who are using meth.
Mm-hmm.
Reach out. This is it can many times be a form of escape.
Mm-hmm.
It's a little bit more dangerous now to escape that way.
Right, definitely.
So yeah. I know you can't physically be there with them, but you can still support people from afar.
Most of.
You can still support people from afar. And just,
I'm sorry, not
no,
trying to interrupt, but just letting somebody know that you're thinking about them, sending them a text, that can change everything.
Absolutely.
Because some people feel like they're not thought about. So, even just doing that may make a whole difference, more than what you would think. So, reach out.
And we'll get through this. Don't just remember that we will get through this. I know it's a hard change. I know that it's a strange transition right now. Mm-hmm. We'll get through this. Absolutely. But yeah, I think like outside of that, I'm good. Just stay safe. Take care of yourselves and take care of others. And just remember, there's light at the end of the tunnel, and this too shall pass.
Yes. I hope everyone stays safe, and don't forget to reach out to Whitman-Walker if you need anything. Like I said, the resource line is pinned at the bottom. And we will chat with you all later. Thank y'all for joining the live. Make sure you follow us on all of our social media, Whitman-Walker on Instagram, Twitter, and Facebook. Make sure you're washing your hands. Yes, Roma, thanks for that. And you're following all the guidelines. And share our page with your friends, share with everybody, and share the lives. And stay tuned because we have one coming every day. So thanks for joining us, y'all. Bye.
Deuces.
Bye, AJ.